Welcome to Lone Star Pediatrics. I'm Bhargavi Kola, board certified pediatrician and fellow of Academy of Pediatrics. Today we are going to discuss a very interesting topic, questions about how do I take care of my baby post-discharge. So oftentimes I do get asked these questions by moms and dads on what are the most important things that they need to focus once they're discharged from the hospital, because the hospital environment is very controlled. You have help and support 24 hours, but you feel lost when you get home. So what do you need to do? So focus on three things: eating, sleeping, and voiding. So eating, if the babies are breastfed, and especially for first-time mothers, it can be quite challenging, because they do have cluster feeds after their 24 hours. For the first 24 hours, babies usually have reserves. So the amount of colostrum that they take in, colostrum is the milk that is produced in the first 72 hours, it is very minimum. So once the 24-hour period goes off, once the 25th hour kicks in, babies might want to eat more and eat more frequent. So that can cause tiredness to the mom. So mom does need to take breaks. So moms, remember to be your 100% to give your 100%, meaning you have to eat, sleep, and rest along with your baby. Easy said than done in most instances, but try to focus on your body's rest too. Now, in case I have to give formula to my baby, can I do it and how can I do it? So you can feed formula to your baby, and in order to avoid getting them used to the bottle, you could feed with a syringe or with a spoon. That oftentimes will help in good latching. And if you have to supplement formula, I would recommend you first breastfeed at least 10 to 15 minutes on each breast, followed by formula feeding with a syringe or a spoon. It's preferred to have a ready-to-feed formula than powder, because oftentimes we either underdo or overdo, causing either less calories or more gas. So that is how you deal with eating. Now, sleeping. Babies do sleep about 18 to 20 hours in their first few weeks of life. So it's quite common for them to be awake at night and sleeping all day. So remember this and make sure that they feed at least every 2 to 3 hours. And in the night times, if mom's tired and you and the father is the only person taking care of the baby, I would say at least every 3 hours in the night. Do not let your baby go beyond 3.5 hours to 4 without eating. So if the baby starves for more than 4 hours, please make sure you wake the baby up to feed. That is very important. Now, voiding. When it comes to voiding, first it's stooling and it is passing urine. So for the first day through 5th day, the number of days is equal to the number of the pee diapers. So day 1 it's 1 wet diaper, day 2 it's 2, day 3 3, day 4 4, and so on. But after the 6th day, the baby has to pee at least 6 to 8 wet diapers in the whole 24 hours. So that's important. You got to count the day and night. Now, bowel movements, the baby has to pass one bowel movement at least in the first 24 hours. And depending on whether it's a formula-fed baby or a breastfed baby, the frequency can change. So if the baby is exclusively breastfed, the baby can poop 5 to 6 times a day, or once in 5 to 6 days. It's still normal. And if it's a formula-fed baby, the baby can poop at least once in every 3 days. That's still okay. As long as the baby passes gas every day, remember, the baby doesn't have to poop a lot. I hope these tips will help you taking care of your baby when you get home. If you have more such questions, please make sure you comment in the section below, and I'll be more than glad to answer it. Thank you and have a wonderful day.